Good morning, everyone. Today, we officially open a Provincial EMS Dispatch Center and return local EMS dispatch services to our regional emergency services. This is truly a great day and a step in the right direction for community resilience for the people that live and work here. As I mentioned and announced last November, this is a new dispatch center will be based right here in the regional municipality of Buffalo. This happened because of a lot of work and dedication of so many people. So with that in mind, I'd like to thank our Premier, Danielle Smith, and Minister Adrienne LaGrange for their leadership in hearing our position on this matter and taking action alongside local representatives, Minister Brian Jean and MLA Tanny Au and many others. Our region is unique in many ways, and we have a provincial government that understands that when it comes to EMS dispatch. So I'd like to also thank my council colleagues for being united on this matter. And it's also important to acknowledge former Mayor Don Scott and the last council for all those that stood up over all the years for local EMS dispatch. Of course, we were also supported every step of the way by the community itself, including International Association of Firefighters Local 2494, emergency response organizations such as HERO, Indigenous communities, industry, and the residents themselves. Your voice and leadership were instrumental in getting us here. Finally, to Chief Jody Butz and everyone with the Regional Emergency Services, including the dispatch team here, your knowledge, expertise, excellence, and commitment were a foundation on which all of this stood, alongside municipal staff that worked behind the scenes, to make this possible. We will always champion you and our Regional Emergency Services. As we begin this new era in collaborative partnership with EMS Dispatch, we look forward to that working together in our region.
Thank you, Mayor Bowman, and good morning, everyone. Today marks a significant milestone as we resume dispatching EMS calls locally in Wood Buffalo with the reintegration of AHS technology into our 911 Emergency Communication Center right here in Fort McMurray. Today's announcement reflects the collaborative efforts and the growing partnership between the municipality and the Alberta Health Services. The five-year agreement for municipal delivery of ground ambulances and EMS dispatch provides stability in delivering a critical service to our region. Our trained dispatchers have an intimate knowledge of our unique geography within our region, allowing them to dispatch ambulances swiftly and accurately. In emergencies, every second counts, and our local expertise ensures a timely response. I want to extend my gratitude to our team of 911 emergency dispatchers. You are the first to respond before our ambulances and fire trucks arrive on scene. You point our response crews in the right direction, and today is a significant day you should all be proud of. Your professionalism and your compassion are invaluable to our region, and so thank you. Our collaboration with Alberta Health Services has been crucial in achieving this milestone. We are all pleased with the outcome and the return of ambulance dispatch to our community. And finally, thank you to Mayor Bowman for your tireless advocacy in returning EMS dispatch to Wood Buffalo. Your understanding of this issue is a big reason why today is a reality.
Thank you, Chief Butz and Mayor Bowman. Our first question is with Brianna Karsten-Smith with Global News.
Good morning. Thanks for doing this. I'm wondering if you can sort of speak to what the last few years has been like without this. Have you had any issues, and can you sort of walk us through any challenges that it's been like since the change a few years ago?
Yeah, thank you for the question. Certainly, there's been challenges since the EMS dispatch was taken out of our center in 2021. And that's been what's really fueled our advocacy and our commitment to ensuring that we provide the best service as we can. We did, after the transition, we did recognize some issues, and a lot of it around as I mentioned, the local knowledge of our region. And in doing so, that gives us an advantage and dispatching and putting our resources in the right area as fast as we can.
I wonder if you could get more specific. Is there, one particular incident you can speak to?
Let me speak to a general trend that we were tracking after the transition. And as I said before, it's about local knowledge. So re realistically or logically, if you're not from or live and work in this region and or this community, you're relying on computer-aided information to tell you where this certain landmark is. Those are things that we all know that maybe GIS tools don't have in front of them. So that's where our local knowledge, our local dispatchers who live and work in this region, they can quickly understand the direction and put our resources there.
Next question is Vincent McDermott.
Hey guys, morning. So I'm assuming that legal fight that started under the previous council has been thrown out. So I'm wondering, when was that legal case formally withdrawn in the courts?
Great question, Vince. I guess formally we've asked that question ourselves, but the legal advice is that we have received is that it no longer is sustained, and so the information that I have is that there's no longer any legal precedence there.
Okay, great. And I know there's in previous articles, I've read about, the challenges with delays and, your people being sent to wrong locations and complaints that the dispatchers servicing this area did not know the area. But I'm wondering, what is preventing dispatchers based in Fort McMurray from doing the same if they're called for surge support elsewhere in the province?
That's a good question, Vince, but the technology that's being installed into our 911 Emergency Communication Center is AHS technology, and that will help our dispatchers. But I guess I just want to reiterate the point that as much as reliant as we are on technology, there's always that certain human element that can bring that local knowledge and that of the geography. If I was to say the bridge to nowhere, I'm not sure if that would be identified if you were to search that on, say, Google Maps perspective. But all of our local dispatchers know exactly where to go on that one, and that would save on trying to discover and understand where that is, and our resources are dispatched timely.
Okay. Just last one. I know earlier in November it said the center would cost $2 million to launch, but who paid that $2 million? I'm wondering how much will the center cost the province and the municipality annually over the next 5 years?
There has been no new center built or created. What this is a reintegration, a reverse of what happened in 2021. So Alberta Health Services technology has been reinstalled into our existing 911 Emergency Communication Center. And with our agreements, we have, like I said, a 5-year ground ambulance agreement with a revenue generation there, and also a cost recovery on the dispatch as EMS dispatching as well.
Okay, those are all my questions.
Next, Jamie Malbuff, CBC.
Hi. So I know when this first happened in 2021, you were keeping statistics on dispatch times and delays to kind of get an idea of how substantial the difference was. So can you tell us what you found since decentralization?
We continued to track since the transition away in 2021. Those I guess statistical information or the data to help inform what we were seeing as a result of that transition. The consistent piece there was there was a number of things that was creating delays, but the number one thing was that local knowledge and trying the dispatcher receiving the information to what the caller was trying to explain to them was creating a delay. So I expect with today's transition and reintegration back that is going to immediately improve, and that I think it's near as noon today that we'll see those improvements to our region.
So do you have any specific averages of delay time since that transition?
Sorry, no, I don't have those numbers at my fingertips. I apologize, but I'll say that instead of specific numbers, we were tracking since that time, and there was definitely a consistent trend that we were observing.
Next question is back to Brianna with Global.
Thank you. I just wanted to clarify. So this begins today?
Yes, that's correct. The reintegration of Alberta Health Services technology back into our 911 emergency communication center, which has been ongoing for the past couple months since the announcement from the Premier and the government, as well as training our dispatchers on the EMS side, and also coming to an agreement on that with Alberta Health Services to provide the services again. So yes, today is the day where that transition becomes reality, and the team is working through it as we speak, but I'm anticipating around noon that our dispatchers will be dispatching ambulance resources in our own region.
And so any new hires, you talked about the new training, but any new hires or things like that, or is it just adding on to what the current dispatchers are doing?
Not at this time. We are going to evaluate. We did step away from the workload and of EMS dispatching. We have not increased our staffing. We are going to feel the workload as it has returned in the last 3 years, and then we will make those necessary adjustments as needed.
Vince, you have another question? Sorry, Brianna, go ahead with one more follow-up. Sorry to cut you off.
No, that's okay. Sorry. I would just ask, as you know, you were lobbying with other municipalities, including Lethbridge and Red Deer. Have you been in any conversations with them, or would you continue to encourage the province to do the same for them?
I was in collaboration with a lot of the other municipalities, and what we found when we were doing that is that we all had differences. Every municipality had a different challenge, and ours was considerably different than others. Our biggest challenges was the locations for EMS dispatchers that weren't from here to locate different geographical locations that are around here, and there's our size. We're larger than the province of Nova Scotia, and a lot of the other EMS dispatchers set up to have aid from other communities. We don't have that, so we were basically running on our own with direction from somewhere else. I do encourage the other municipalities to kind of keep working with Premier Smith as well as Minister LaGrange and things that'll work for them as well.
Next question to Vince.
So Brianna just asked my question. Actually, how many dispatchers are there, and where in the municipality are they based? Just the main fire hall?
Vince, there's 3 dispatchers on shift at all time. And remember, they provide two different services. We answer the 911. All 911 calls in the region goes to our emergency communication center, and then secondly, we do the emergency dispatching. So as of today, we will be dispatching fire and EMS with local dispatchers to our own resources, and then the RCMP will continue to be transferred to Edmonton. The second part of your question, I'm going to just reserve from saying that out publicly for, I guess, continuity purposes. We want to maintain the security of our 911 dispatch. It is the heart of our emergency services, and I would hate to see anything ill will come of that location and or the team. So respectfully, I'll just kind of hold that, but I can assure you that it is within the regional municipality of Wood Buffalo.
Sure. Thanks.
Thank you, Vince. Next question, Ryan McNally, Rogers.
Hey, folks. I think this question's for Mayor Sandy Bowman, but I guess what have you kind of heard from residents regarding the absence of local EMS services, and how has that kind of influenced things in Fort McMurray area?
Thanks, Ryan. Are you referring to before we took the EMS back, or while we didn't? While it was run through AHS?
Yeah, I guess in this gap, for taking this back to being local.
The community is incredibly excited, and one of the reasons we push for things like that is because of the community. When I look back to when we started kind of this, I'm going to say quote unquote fight to get the EMS back. I did listen to some 911 calls, and listening to those calls was completely heartbreaking to see people suffering and not being able to get the correct information to our first responders to get to the locations. So right now the community is extremely excited and happy to have this back, and their best advice comes from the people here, and they're the ones that have to deal with us, and we want to make sure we're doing the best we can to service the community that lives here.